There is just 1 week left until the Affordable Care Act's open enrollment period ends. But for some states, another deadline looms, leaving just 6 months to fix problems still plaguing their web-based exchanges in time for 2015's open enrollment. As Bertha Coombs reports, it may be harder to effect some of those fixes than to start from scratch.
After a notoriously bad start, Secretary Kathleen Sebelius is looking for a strong finish to ACA open enrollment. The federal healthcare.gov marketplace now works well for the 36 states it serves, but in about half of the states that built their own exchanges, problems persist.
We certainly have some states that get an F grade. Some that are in the D category.
Among those not making the grade, Hawaii, Massachusetts, and Vermont, which all used CGI to build their exchanges, the same contractor blamed for problems with healthcare.gov. The Bay State fired CGI last week. Maryland also fired its contractor, North Dakota-based Noridian. But even big-name tech firms stumbled. In Nevada, Xerox is under fire for its faulty software. But CEO Ursula Burns is grateful that the state will keep her firm on.
Having a disciplined engineering development and rollout is what is needed in these exchanges. Just like anything else, it's kind of like getting a person to the moon. You don't do it fast, you do it right.
Nothing seemed to go right in Oregon. Federal and state investigators are trying to figure out why the state's exchange, built by database giant Oracle, was never able to enroll people online after more than $240 million in federal grants. Analysts say, like CGI, Oracle never built a system end-to-end and didn't have enough time to test.
Oracle Policy Automation rules engine is used in numerous successful exchanges, but to have the entire framework applied, or the entire IBM Current framework applied to this particular solution had not really been proven out.
The exchanges that worked best, California's, whose lead contractor was Accenture. Washington State, Kentucky, Rhode Island, and Connecticut, which were all built by Deloitte Consulting. Connecticut's Kevin Cunahan says the key to success was that his team worked closely with Deloitte to figure out what was achievable under a tight deadline.
We were building a Cadillac, and we decided that we needed a Ford Focus. And we scaled back about 30% of what we originally wanted. And coming out of that was a much more focused type of workflow.
With 2015 open enrollment starting in less than 8 months, troubled exchanges face another tight deadline. States like Oregon are going to have to decide soon whether they're going to try to fix what they have or scrap it altogether after investing hundreds of millions in federal grants to start fresh with proven technology. Bertha Coombs, Nightly Business Report.